Good afternoon. It's a great day to be a Wildcat, and welcome everyone. I am Dr. Beth Davis, Associate Dean of Clinical Programs. On behalf of the Veterinary Health Center, the faculty clinicians, house officers, and staff of the VHC, we would like to welcome everyone to the White Coat event and welcome the class of 2024 as they earn their white coats and receive them today. We would like to thank Hill's Pet Nutrition for their generous support and the College of Veterinary Medicine for making this day possible. And with that, we would like to, again, congratulations to the class of 2024. Let's start with a round of applause. And I am going to turn the podium over to our Dean, Dr. Bonnie Rush, the Hodes Family Dean, College of Veterinary Medicine.
Wow. I don't think we've ever had this many people in this room before, ever. I'm Bonnie Rush. I'm the Hodes Family Dean of the College of Veterinary Medicine. And you may wonder, who's the Hodes family? We have two Hodes family members here today, and one of them had to get permission to miss kindergarten to join you. Alex, can you wave? Wave to the crowd. The other Hodes family member is a 1979 graduate of our college, Dr. Steve Hodes, and he and his wife, Colleen, went to New Jersey after graduation and started a very successful veterinary practice. And their son, Brian, graduated from our college in 2011, along with their daughter-in-law, Dr. Jessica Hodes. And they run a practice in Rose Hill, Kansas, just outside of Wichita, also incredibly successful practice. They've hired 3 students out of the last 3 veterinary classes. And Jessica was in the news this week. Maybe some of you saw that, where there was a Clydesdale. Raise your hand if you saw that story about a Clydesdale stuck in the mud. That is Dr. Steve Hodes' daughter-in-law that worked for 7 or 8 hours to successfully extract that Clydesdale from that, what would have been certain death. The Hodes veterinarians are tremendously committed to the science and art of veterinary medicine. They are also committed to the business of veterinary medicine. Please help me welcome Dr. Steve Hodes to the podium.
The students that are in the 3rd year, going into the 4th year, are right here, I assume? Okay. Let me tell you what my take on it is as far as your objectives this 4th year, because if you view it this way, then I can pretty well assure you that your success is going to be really spectacular. Every visit with a client, start looking at it in terms of a job interview. That client is looking at you, watching you, listening to you, and if your explanatory style, if your exam room presence suggests that you're comfortable with them and suggests that you know what you're talking about, then that client may just give you the privilege to take care of their animal for a great many years. Now that reputation, that relationship isn't going to happen so much this year going into the clinic. You're not going to see a lot of repetitive clients as 4th year students in the clinic. But those of you that are going to go into practice, you hope that those clients see in you somebody that truly cares, somebody that's got a very kind explanatory style, somebody that oozes confidence. And that for you next week in the clinic is going to be hard, because right now you're all a little nervous and you're wondering like, did I study enough for 3 years? Do I know my anatomy? Do I know my physiology? All these courses that you were trained to master this coming year you're gonna put all the pieces of the puzzle together. If I'm making you nervous, good. Nervous is good because it'll get you to pay attention. Bear with me because I'm going to make you more nervous. The clients that come to see you, they are all nervous, and so you need to find a way to be patient with those clients. You need to listen to them, and don't say too much right off the bat. Let them talk, let them tell you why they're there, and then it's going to be your turn, because you're going to have to ask the right questions. If you don't ask the clients the right questions, you don't have the right answers to find out what's going on with their animal. And my point is that you need to know, is this animal eating and drinking okay? Is there vomiting and diarrhea going on? How about coughing and sneezing? Is it drinking and urinating more or less? Is it full weight bearing? And which leg is it limping on? Because those of you that have some experience with horses and you go into the clinic this year, if you have an intent to work with horses, it can be pretty challenging to figure out which leg the horse is even limping on. And the client's not interested in you guessing which leg is the problem. If you're going to go to the Northeast and you have a dog come into the clinic that's running a bit of a fever that's limping, the client's going to tell you that it's limping on the left front leg. You're going to look at it, it's the right front leg. The dog's acting a little lethargic. And your number one differential might need to be Lyme disease, which you're not seeing very much here in Kansas. But you're going to see it a whole lot in the Northeast. And those animals really don't necessarily need radiographs. They need doxycycline or an antibiotic that's going to address that Lyme disease. Next subject. The physical exam. Bear in mind that physical exam that you are doing for these patients, that is the single diagnostic procedure that gives you the most amount of information at the least amount of cost to the client. And if you understand that one of the really big concerns about clients is, what are we going to charge them? What's this going to cost? You're not going to have the liberty when you get out in practice to run CTs and MRs and blood work and urine analyses and every test known to man to find out that this animal's got a broken toenail. And I have had a lot of dogs come into the clinic that have been limping for days just because a toenail was broken and nobody paid attention to that. And I know of animals that had radiographs taken on legs that all they needed to do was get rid of the broken toenail. Look at your patient very, very closely. Take him out of the cage, walk him around the exam room. Be sure you're looking at him closely. You will find amazing things under all that fur. When you're reaching around on the scapula, and the spine of the scapula is very prominent on the right front leg, and the left spine of the scapula is perfectly normal and barely discernible, there is some sort of neurologic atrophy going on, making that spine of the scapula apparent. Now you got to find out what it is. The intern that you're working with in the clinic, the resident that you're working with, the clinician that you're working with, they're going to be very impressed with you if you have examined that German Shepherd's fur and right away go to those that are working with you and let them know, I found this, and what do you think? And you may not know what's wrong, but at least your physical exam was thorough enough to pick that up. This one I want you to take home, remember it, never forget it. You will make enormously more mistakes for not looking than for not knowing. They have poured into you for 3 years, soon to be 4, an immense amount of knowledge, to where you go home at the end of class and you wonder, geez, why do I need to know all this? But this 4th year is your opportunity to start integrating all this knowledge, getting good at figuring out what is troubling these patients, so that people that come to see you like you, trust you, give you the privilege of looking after that animal. So you will make far more mistakes because you didn't look than that you didn't know. You have a cat, for a quick example, you have a cat that's vomiting, please somehow look under that cat's tongue, and you will find dental floss, thread under a cat's tongue, I assure you, a few times in your career. And then you get under there, you try to pull it out. Does it come? Don't pull real hard because it may be stuck down in the stomach. But if you don't look, you're not going to find. Your goal is to come up with a diagnosis, differential diagnosis, definitive diagnosis, prognosis. Is this animal going to get better likely? Because your ability to explain all this to the client, your explanatory style, if it is really good, you are helping that client make decisions as to how they want to spend their money. They will be much more willing to commit to the treatment proposals that you are putting forth if you put them forth in a convincing manner. If you are kind of shy, a little bit unsure of what you're proposing, figure it out, but you can't come across to a client that way, or you will dissuade them from doing something that might save that animal's life. So this year, you will be much more confident 52 weeks from now than you will be next week. Next week, you'll be a nervous wreck. And that's okay. It really is. Just don't make it obvious to the clients, because they're not going to be happy with that. But you will be nervous wrecks. And I don't care if you're girls, if you're boys. To me, it's girls and boys. You come across real nervous to those clients. Somehow figure out a way to don't make it obvious. Hard skills, soft skills. Your hard skills. We all walk around as veterinarians with one of these around our neck. So all of you are going to have one of these around your neck mostly every day in the clinic. It's not jewelry. You need to get good with this. And my point being is that a dog, a cat, a horse, their rate and rhythm is very different. And if you can get it into your head what the normals are, and get that unquestionably into your head what the normals are, you will pick up a Doberman with cardiomyopathy quickly. You may not know what the problem is, and that's okay. You're not supposed to know everything ever, or you're going to know everything. But your first year in the clinic, you're surely not going to be that proficient with using this. But I would propose that you take this off your neck as often as you can and listen to as many patients' hearts, cats, dogs, horses. There's exceptions. I have never listened to a bucking bull's heart, and probably never will, and I personally wouldn't recommend you do it. But somebody here on staff may want you to try. I don't know that I'd go along with that plan, but you're welcome to try. Use these often. Your stethoscope, your otoscope. You need to get very proficient with these technical skills. You need to be able to look at a radiograph. And right now, you might be pretty good at it, but it's a lot of different shades of gray with loops of gas. And realize your clients don't even know which end has the head end on it, which end has the behind on it. And so you're going to have to make this clear to the clients with the radiographs that you're going to go over with them as to why this stomach looks like it does, why that bladder looks like it does. Your soft skills. Your soft skills are you personally. Your hard skills, you're going to learn how to use and develop technical skills with great assistance from the clinicians, the interns, the residents. Don't dismiss the nurses that are in the hospital. A lot of them have a lot of experience, and they are very good at what they do. And so get your money's worth. Have everybody contribute to you getting decent at what you do. The soft skills, this is all you. It's your body language, your eye contact, your ability to communicate in a way that this client knows what you're talking about. The majority of clients have no clue what Addison's disease is all about. So when you have an underactive adrenal gland and you're talking to them about Addison's disease, and you're very well versed in that, I'm sure, but the client has no clue what you're talking about, and you're going to have to put it in terms that they understand so that they then opt to embrace the treatment option that you are proposing. Otherwise, you let them know that this animal has something kind of serious, and your ability to convey how well it can be treated by you, the interns, the residents, the clinician, they may be inclined to not treat it because you did not present the treatment plan in a way that they were willing to embrace. So you got to get your soft skills up and running very well. You speak slowly, a lot of empathy in your tone. Convey that you care. There's a saying that you've heard, maybe yes, maybe no, but the people don't care in the least how much you know until they know how much you care. You've heard that? Probably? Good. One other thing I'll make a big point about, you're going to hear about the standard of care and evidence-based medicine. The standard of care in 2023, trust me, is vastly different than when I graduated in 1979. In 1979, I worked for a veterinarian that put everything on tetracycline because tetracycline was cheap, and in his estimation, everything got better by and large. And I had to argue with him repeatedly because my point of view, the instructors even back in 1979 that trained me were good. And they let me know, there were doctors on staff here that let us all know that an awful lot of your patients will get better despite what you did and not because of what you did. So putting everything on tetracycline clearly was not the way to go. We didn't even have Clavamox. We didn't have digital radiographs in 1979. Trust me, the radiographs were just a whole bunch of shades of gray. It was like looking at a broken television. You're going to need to take these crystal clear digital radiographs nowadays and explain them to the clients what you're seeing, what's wrong, and what you and the intern, the resident that are working with you, what can be done about this. Your job is to give these people an intelligent diagnosis, prognosis, and cost. I'm fairly sure that you are not going to have a whole lot, if anything, to do with discussing cost with the clients this fourth year in school. That's beyond your skill set, if you will, at this point. You have enough to worry about trying to come up with a reasonable diagnosis and prognosis. But if discussing money with people is very difficult for you, and that would not be a surprise, then I would practice with each other, because you're going to have to convince somebody that their blocked cat, their bloated dog, their dog that got hit by a car, this horse that has colic and needs surgery, you're going to have to talk to these people about a whole lot of expense with no guarantee that this patient is going to get better. But if you can convey to them with your exam room presence, your confidence, your explanatory style, that everybody involved is going to do their very best. Historically, we've had great success at turning around bloated dogs so that they can live a good long life. Of course, after they've probably had a gastropexy, then you'll get a lot of these to treat. If your demeanor is very negative, pessimistic, your style is not positive, then treating isn't going to be as good. Evidence-based medicine. Evidence-based medicine, whoever came up with that is a genius. Because years ago, we would just look at an animal, try to guess what's wrong with them, and not worry about a whole lot of lab work. Mrs. Nelson bred wire-haired dachshunds in northern New Jersey, and I took care of her. And she had a veterinarian prior to me that was significantly older. He never ran blood work on any of her dogs. And she would ask me for a number of years, Steve, why do we have to always run blood work on my dogs? Dr. Singer years ago, he never ran blood work. I had to give her, song and verse about why blood work is very objective as far as kidney function, liver function, blood sugar levels, yada, yada. And so your explanatory style, your grasp of the details is crucial. You need to be a calming force. You need to be a voice of reason. The flaw with evidence-based medicine is that you are going to be trying to make decisions on the best evidence, best amount of information that you have available to you at the moment. But you don't have the perfect evidence that you would like to have. So while you may have the best evidence that all this has provided you with, you do not have the perfect evidence that you wish you had. And why the difference? Well, the big why is because a lot of clients are going to step back and say, whoa, I don't think I can afford that. Can we just try to treat it? And then you'll go with the best evidence you have, try to treat it, and perfect evidence you'll have to do without. I told this graduate next week that I was going to talk about something that he and I dealt with last week, beginning of the week. I'll tell you who he was in a minute, because I told him that I would give his name if that was okay, and you all probably know him, so you then can talk to him and tell him he did well. We had a female cat in 2 weeks ago. that was having urinary problems. So feline lower urinary tract disease, feline interstitial cystitis, whatever you want to call it, but this cat was having urinary problems. Jackson Ralston's evidence-based medicine approach was to propose to this client that, well, okay, we need to get a urine sample, we need to do an ultrasound, we need to verify if does this cat have bladder stones, because recent data I've seen, anywhere from 10 to 40% of cats with this condition can have bladder stones. If they have bladder stones, those stones either need to come out, be dissolved, but they can't stay there. The condition isn't necessarily going to get better. So Jackson's proposing to this client that we need to get an ultrasound. And the client gets her folks on the phone. The dad is on the phone with me. We're on speakerphone now. And he goes, you know, what is that going to cost? So Jackson goes, well, should we tell him the total of what this is going to cost? I said, well, yeah, they need to know what it's going to cost. And again, you're coming out of your 4th year in the clinic. You have not had experience discussing cost with clients. That's going to come your first year in the real world. But Jackson's looking at me because now he doesn't have the perfect array of evidence that he would like to have, and we're going to have to function accordingly. So he gave me the look, and the look is, so we're not going to get an ultrasound to determine if there's stones. And I chimed in and I said, I've got it. And I said, sir, to the girl's dad on the speakerphone, I said, that's okay, I understand you can't afford to go with plan A. We're going to go with plan B. And right away, he comes back at me on the phone. Well, is plan B going to be okay? So on one hand, they're telling you that plan A is not doable financially, and now he's challenging me about plan B, but he doesn't know what plan B is. So my point is that every interaction with a client is a job interview. You got to sell them on your ability. And Jackson's looking at me, plan B? What's plan B? So plan B was to get this cat on prescription diet, and if there are some stones, perhaps, or at least sediment, perhaps we can dissolve that up. We don't have any urine because this dog's bladder on the radiograph that we took for free, because we had to find out something, had so many stones in it that there were lots, and so we at least showed them that, but the ultrasound was going to be used for an ultrasound-guided cysto to try to get urine. So we had to do the best we could. We went with plan B. And so you need to, in your presentation, start formulating in your mind plan B, because plan A, a lot of clients aren't going to let you do. When you get into the real world, you are building relationships and a reputation. If you come across very confident, very sure of yourself, your soft skills are perfected, I promise you, your soft skills, your communication style, your empathy, your kindness is almost more important to your success than you knowing how to do a kidney removal. The surgical procedures are technical skills. You can get to do them. Back to Jackson Ralston last week, he hasn't even graduated yet, and last week he and I did a pyometra on a dog, and we had another dog that had a linear foreign body that went from its stomach to its colon. It took 2 enterotomies, 2 resection anastomoses, and a gastrotomy, 5 different procedures to get this dog through its problems. Both dogs, here we are, almost 2 weeks later, are doing fine. So when you see Jackson, pat him on the back, because you all, and him and you as well, this 4th year, you are phenomenally trained. And the knowledge you have in your head, you don't have an awareness of how good you are. But this 4th year, you're going to get your soft skills up and running, your technical skills. Get this off your neck and figure out what a cat, dog, horse, heart sounds like, so that when you hear the abnormal, you can go to Dr. So-and-so, the intern, the resident, and they will give you the look, which means, you're pretty good. You know what you're talking about. With that, you're going to get a white coat on you. How about that? All of you are getting a white coat.
Dean used to do a lot more speaking at this ceremony, but I felt like it was more important that the class that's about to be seniors would want to hear the advice from the class president that is no longer a senior. So it is my privilege to introduce to you class president for the class of 2023, Dr. Byron Madrigal.
Wow, that is kind of scary to hear. Thank you for that introduction. That's pretty much like the first time I've heard that Dr. Byron Madrigal, especially so officially as here today. And in exactly a week, I'm going to be walking across the stage for graduation. And it kind of puts into perspective what you guys are feeling. Because I know I'm feeling a little bit of nervousness, right? A little bit of excitement. And kind of like, what's coming next? What's going to happen? And I know that's exactly what you guys are feeling, because I was right there a year ago. And I thought about what can I come up here and say, and what advice can I offer you guys? But you're going to get great advice from the other people here on stage with me, from the colleagues sitting next to you, from the amazing clinicians, faculty, staff that you're going to work with for the next year. They're probably going to give you way better advice than I can offer you at this point. So instead, I think I'm going to talk to you about something that is just as important as any piece of advice, and that's moments. Over the next year, focus on moments. So think back to the moment that you got accepted into vet school. The moment you either got that call, that email, the letter in the mail, whatever it was, and think to the emotions that you felt. You might have felt pride, you might have felt the same nervousness, the excitement, who knows. But at that moment, I'm sure you had your why right in front of you. Why you worked so hard to get into vet school, why you worked so hard to make it through. And over the last 3 years, you are in these seats because you've earned those seats, right? Here at the white coat ceremony. And you've had your why. Over fourth year, it can get kind of crazy. And sometimes you just don't take the moment to stop and remember your why. So make sure that you're doing that constantly. And the reason I say that is because there are going to be tough moments. And sometimes we fear that those tough moments are going to come from a clinician that we let down, or that's going to come down hard on us if we don't know, or a client, or someone else. But sometimes the toughest moments actually come from yourself, right? Because we tend to be the hardest critics in our own lives. And I didn't plan on sharing this story today, but I'm gonna do it anyway. But I made a mistake, and it took me a long time to forgive myself for that mistake. So when we were going to do a castration on a little cute Maltese, we have a pre-medication, right? And I know you all know this, that we give before we give the anesthetic induction medication. And that is to basically prevent any side effects from the anesthetic induction agent that can be a little bit dramatic. And those crisp, new, beautiful white coats that you're about to receive in just a few moments have two pockets, one on the left and one on the right. And I had my pre-medication in the left pocket and my anesthetic induction in the right pocket. And when I went to inject my patient, I reached into the wrong pocket, pulled out the wrong syringe, and injected the anesthetic medication before I gave the pre-med. I knew what I had done the moment I did it, and I panicked. I don't know if any of you have ever felt that feeling where your heart drops straight to your stomach, and if you haven't yet, you'll probably feel it at least once during fourth year when you know you did something wrong. And when that moment hit, I ran, I found our anesthesiologist. The dog was okay, and we actually went ahead with the procedure. Everything turned out fine. But I was so hard on myself. And I remember that the anesthesiologist talked through it with me, and they were very supportive. They were like, learn from your mistake. Obviously, pay more attention next time. And now, before I ever give anything, you bet my eyes are on that label, on that syringe, double checking, triple checking. But I couldn't forgive myself for weeks, and I was questioning whether I deserved a spot as a fourth year student, whether I was going to be a good veterinarian, and whether I had what it takes to get through the rest of the year after making that mistake. So kind of back to the whole moments, give yourself a moment to give yourself grace, because you're gonna make mistakes during fourth year. Some of them are gonna be small. Some of them might be a little bit bigger. Either way, you're going to have a support system. That's going to be the clinicians that you're working with. That's going to be the colleagues sitting right beside you. But give yourself some grace to make those mistakes. That's part of the reason why you're going to be a fourth-year student. But also, that's kind of just part of veterinary medicine. You're going to make mistakes because there's no such thing as a perfect veterinarian. And there's also definitely no such thing as a perfect fourth-year veterinary student. So give yourself grace, cut yourself some slack, and just make sure you learn from those mistakes and you keep moving forward. And everything is going to be okay. On a bit of a lighter note, also give yourself moments to live life. Remember that why. Fourth year is going to be tough, fourth year is going to be busy, but fourth year is also going to be a lot of fun. It's kind of like the highest highs and the lowest lows, because you're going to be working hard and working long hours some days, but you're also going to have time to hang out with friends, meet new people, make new friends that you didn't bond with during your last 3 years in vet school. And that's going to be really special. So give yourself that time to live your life, to be a human being, because each of you sitting in this room is obviously highly intelligent and hardworking, but you're also a lot more than just a future veterinarian, right? So give yourself time to do those things. Give yourself those moments. And the very last thing I want to say is give yourself moments to help each other out. Your biggest support system is actually going to be the colleague sitting right beside you. When you don't know something, the clinician, the residents, there's going to be other people there, the nurses, they're going to be able to help you. But a lot of times you're going to turn to the other fourth year student with a panicked look on your face and say, all right, what's the dosage of dexmedetomidine? Or what do I do for this patient? Or what is going on with this case, right? And half the time they're not going to know either. And that's at least going to provide you some good feeling of like, all right, it's not just me, right? And if they know, great, then they help you get to your answer. So definitely just be a really good support system for each other. Give yourself those moments. Fourth year moves fast, and it's really easy to forget to slow it down and be there for one another, because sometimes you get stuck in survival mode, and when you're in survival mode, you just kind of keep going. So pause, give yourself the moment to cut yourself some grace, give yourself a moment to be a human being, and give yourself a moment to support one another, and everything's going to be okay. And the year's going to go by fast. Like really fast, because this does not feel like it was a year ago when I was sitting in your seat. So definitely, strap in. It's going to be a lot of fun. You're going to make mistakes, and that's okay. You're going to have a good support system. You have like the smartest clinicians, the smartest veterinarians, literally leading you through the next year. So it's all going to be okay. And don't forget to have fun. It gets busy. You might get a lot of cases sometimes, and that might feel overwhelming. But remember, the cases that you don't get during fourth year, you're going to have as a first time as like a doctor, where like you have to be the adult in that situation. So take those cases. Sometimes life hands you a little bit too much lemons, but make the lemonade, because it's going to be a lot easier once you graduate and you've been able to see and do things with the guidance that you have as a fourth year student. And it's all going to be okay, and it's going to be a lot of fun, I promise you. Fourth year, everyone says it, and it's true. Fourth year is the absolute best year. And I can't wait to see what all of you accomplish. Looking back at the last 3 years, I've really gotten to know a lot of you, and you guys are going to do great things over the fourth year. So congratulations.
Wow. Thank you, Dr. Madrigal. That was absolutely fabulous. You guys ready? All right. So we are very fortunate today. We have Gina Jensen as our marshal, and we are going to get started with the white coat event. So Gina, we'll go ahead and have our students, we'll have 2 rows and start to get lined up. Once our students are lined up, I'd like to go ahead and introduce our faculty that have been selected by the class of 2024 to cloak the students today. So if I could ask the faculty to please stand and walk towards the coats. We have Dr. Matt Basil, Assistant Professor, Anatomy and Physiology. Dr. Lori Beard, Professor, Equine Internal Medicine, Clinical Sciences. Dr. Warren Beard, Professor of Equine Surgery. Dr. James Carpenter, Exotics and Zoological Medicine. Dr. Ken Harkin, Professor of Small Animal Internal Medicine, Dr. Brian Herron, Assistant Professor in Parasitology, Dr. Emily Clockey, Professor of Small Animal Surgery, Dr. Matt Meisner, Professor of Livestock Services, Dr. Derek Mosier, Professor and Department Head in Pathobiology, Dr. Emily Reppert, Associate Professor, Livestock Services, and Dr. David Upchurch, Assistant Professor, Small Animal Surgery. And with that, we will go ahead and get started. And we will start with Tate L. Ackerman. Kyla Adams. Mariah A. Arts. Hannah Marie Barber. Deidre K. Bean. Dawson L. Black. Bristol Bluma. Courtney Babcock Borden. Eva L. Borgman. Tegan Bowers. Elizabeth Marie Brand. Madison Taylor Bro. Ann M. Breen. Elizabeth Rizvani Berg. Grace Kalo. Nicole Cassell. Elena T. Comstock. Katie Marie Condon. Riley M. Cox. Adlin Crockett. Diana Brooke Kroll. Justina Elizabeth Davis. Jessica Marie Dio. Melissa M. Dorner. Abigail Grace Drost. Jameson L. Earlywine. Alexis Fenton. Caitlin L. Fox. Bailey R. Fritz. Angela Marie Gaggiano. Aaron Gates. Haley R. Geiger. Miranda Lee Gibbon. Abigail Jo Gibbons. Nicole Daniela Graham. Amaya Gray. Jamie L. Gray. Samantha Gray. Catherine Grint. Madeline G. Hall. Natalia Henk, but is not present today. Valerie C. Haskett. Emma Hawkins. Lily Heinen. Jensen Heron. Melissa R. Hill. Caitlin Michelle Hoke. C. Nate Hollis. Sarah Ann Holloman. Abigail Horswell. Corey L. Huff. Hannah F. Huber. Katie Jackson. Nathan W. Jackson. Alex Johns. Jesse Johannes. Sarah Keck. Joseph Kempen. Abigail Kaiser. Hallie Olivia Clefcorn. Rachel Keel. Loretta Ann Lacey. Nikita Lakani. Gabrielle Lamons. Samantha Lorraine Leach. Yuri Lee. Shengyu Sean Lin is not present today. Shannon E. Lloyd. Michaela Long. Oh. Got it. We all make mistakes. Thank you. I apologize. Taylor Lyle. I Christina B. Marquez. Zara Martinez. Kinsley T. McComas. Walter Myers. Jonathan Alejandro Mondragon. Alicia M. Morris. Michaela Sue Musselman. Kendall Brooke Neal. Darcy Nightingale. Shannon O'Day. Cheyenne Osterhaus. Megan O'Toole. Nina E. Paranspe. Jinwen Peng. Grant L. Pimple. Jade Reese. Alex Andrea Rivas. Nicole Robin. Laura A. Sajazi. Kenneth Santiago. Conrad Shelkoff. Paige H. Schmidt. Pollock Shaw. Allison A. Scooble. Courtney Denise Smith. Marika Smith. Alyssa J. Sorum. Catherine R. Stenger. Morgan D. Strader. Claire Taylor. D. Angela Thompson. Amanda Tlassel. Kat Trinkle. Trey D. Tomlinson. Eliza Kate Turnage. Haley Wagner. Laura Walsh. Hadley Watson is not able to be here today. William Tyrus Wang. Hannah Rose Westermeyer. Allison M. Wheeler. Carly J. Williams. Taylor C. Williams. Grace Wilson. Holly Ann Wilson. Richard Wood. Margot B. Wadawa. We are honored today to have two very special guests, Brianna Smith, Cyprian Roy, who are going to receive the white coat for Tristan Roy. I would like to invite the class president of the class of 2024, Melissa Hill, to lead the Pledge of Professionalism.
Hello everyone, thank you so much for coming out. It means so much to us to have such a large group of supporters here for us today. We are so blessed. And to my classmates, congratulations. We earned this over the last 3 years. It's been a tough ride, but we made it. So now I'd like to ask you all to stand as we recite the Pledge of Professionalism. As I prepare for my clinical training in veterinary medicine, I will enter into a relationship of mutual respect with my professors, my colleagues, and my clients. place the health of my patients above all other considerations. Accept responsibility only for those matters for which I am competent. Maintain the trust expected of a healthcare professional. Work toward improving my sensitivity and skills in human interaction and continue learning throughout all the days of my life. I acknowledge my obligation to support and sustain the honor and integrity of the veterinary profession as symbolized by the coat that I now wear. I make this pledge freely and upon my honor.
Excellent. This is a wonderful profession and one that is made of many partnerships, networks, and collaborations. We're extremely fortunate to have a very strong collaboration with Hill's Pet Nutrition, and they have helped to sponsor the event today, and we thank them for that. And we have Dr. Karen Shenoy here to share a few words with the class of 2024. Dr. Shenoy.
Thank you so very much. Good afternoon. As Dr. Davis said, I'm Dr. Karen Shenoy. I'm the U.S. Chief Veterinary Officer for Hill's Pet Nutrition, and it's just a wonderful honor to be here sharing with you the excitement of the day. I do have just a few words of advice also to share, and I think you'll see some common themes with what my colleagues have already shared with you. First off, as I was thinking about the comments I would share with you today, it occurred to me that it was actually almost exactly 20 years ago to the day that I was in your shoes. I'm a 2004 graduate. I'm a gopher, not a wildcat, so University of Minnesota. And I was sitting in the spring of 2003 in your shoes with my classmates, and that's when, of course, we got our white coats and nervously anticipated our preparation into clinics. You'll find that once you're at the stage of being post-graduation and you've fully entered the profession, there are certain moments in vet school that will stick with you always. Memories of my white coat ceremony have certainly stuck with me. I'll say, though, what's even more vivid in my mind today, 20 years later, is the memory of sitting in the internal medicine rounds room on day one of my very first clinical rotation, internal medicine. Luck of the draw, that's the tough rotation that I got to start off with. I remember sitting there with several of my classmates, anxiously waiting for our day to kick off. And I specifically remember that my classmate Wendy offered all of us gum. We sat there nervously chewing a bit in silence. And then internal medicine specialist, who some of the faculty member might know, Dr. Bob Hardy, who actually is a really sweet guy, but is a bit of a legend and who I found rather intimidating in vet school, popped into the room and he said to us in this gruff voice, "You're not scared, are ya?" It just sticks out in my mind like it was yesterday. So reflecting on that and all of my own experiences, I do have some advice for you. I'll be brief and you can get on with your celebration, but number one, and this has already been said today, is don't be too hard on yourselves. You all have different strengths and weaknesses. You will all have rotations where you are more comfortable and others where you are more out of your element. It's completely normal to feel out of your element, and I just want to advise you to really quiet that self-doubt in your mind. Simply take things one step at a time. One rotation at a time, one day at a time, one case at a time. Clearly you've made it this far, and you got through the first 3 years of vet school by taking things one semester at a time, one class at a time, one test at a time, one concept at a time. When I was in vet school, my mom always used to say to me, inch by inch, everything's a cinch. And at the time, I honestly found that rather annoying, and it certainly felt like in vet school nothing was a cinch. But she was right, just take things one step at a time. Number two, support one another. As you enter clinics, how you show up is probably more important than what you know. think that's also a theme you've heard from others today. Teamwork and collaboration will be important skills now and certainly in your future roles as veterinarians. Step up, help a classmate who needs you, and don't be afraid to ask for help from others. Number 3, be curious and keep an open mind. Again, as you enter clinics, how you show up is probably more important than what you know. I have certainly found this to be true in my professional life post-graduation as well. If you lean into the uncomfortable and are willing to try new things, it will take you far. With that said, the most important thing for today is to take a deep breath. Sit back and reflect on all that you've achieved to date. As successful, high-achieving individuals, I would bet you don't take time often enough to truly appreciate and celebrate what you've achieved. A lot of hard work and perhaps literal blood, sweat, and tears have brought you to where you are here today. As you celebrate, be sure to recognize your friends and family for the important roles that they've played in helping you get where you are today. So, K-State College of Veterinary Medicine, class of 2024, congratulations on all that you've achieved. We at Hills Pet Nutrition are grateful to be able to support you in your journey today and throughout your careers. And again, it's an honor to be here. Congratulations.
Well, once again, congratulations to the class of 2024 on earning your white coats and getting ready for this next step in your education and your professional journey. And with that, we would like for you all to reach into your right pocket, and from those that have walked in your shoes before, alumni of this college have prepared a message for each of you to help inspire you and encourage you as you enter into your clinical rotations. And with that, again, congratulations, you have earned this next step. And with that, we are going to go ahead and wrap things up. From a housekeeping standpoint, we know those white coats are not going to look like that for much longer. So if we could capture this moment together, have all of the students up, we're going to get a group photo. If we could excuse the families outside of the room, we'll get the group photo, and then everyone can come back in and we can open the room to everyone for the remainder of the afternoon. Thank you very much.